Dr. Stewart, we're back again because you left us hanging. So last time we talked about the anatomical blockage and how that affects our breathing, how that affects our overall immune system. But you said there's an answer to that. What is the answer? Fill us in.
Okay, so this is very simple. 200 years ago, studies by an anthropologist named Porcini found that he went to different civilizations all around the world and found that jaw sizes were big enough to accommodate 32 teeth. That means your wisdom teeth. Most of these jaws, these skeletons that he studied, had all of their teeth intact with no crowding. Nowadays, it's rare to see somebody that doesn't have some crowding in their teeth or that still has the wisdom teeth. A healthy jaw structure means a healthy airway structure. Our jaws are too small in not just America, but pretty much any civilized country. Because of over the years, I talked about those reasons last time, so I won't go into that. But in general, crooked, crowded teeth means small jaws. Small jaws means an impingement on the airway, which is right behind our jaws. The air goes through our nose, through the oral pharynx, down the nasal pharynx, and down into the lungs. If our jaws are small, all of our tongue, all the tissue is pushed back into the airway. Obstructive sleep apnea, it's rampant in this country. Upper airway resistance and snoring. Those are three very significant, serious medical conditions that people die from. There are several celebrities over the last several years that have died from obstructive sleep apnea. So what can we do about it? In generally the answer has been a CPAP. It's a positive airway machine. Strap it, got a mask that goes on your nose or in your nose in your mouth, and it pushes air in down into the lungs while one is sleeping. So that stops the sleep apnea while someone's sleeping. Another device is an oral appliance that pulls your jaw forward and opens up the airway while you're sleeping. The problem is that these people still have an airway issue the other 16 hours a day. It's not just something when you sleep. That's just when it's the worst. What we can do now, the only way to treat airway and deficient jaws in the past was to do jaw surgery where the jaws were actually pulled forward and wired shut, and then after everything healed, then you have a nice bite and a nice airway. Now, because of studies done by Dr. David Singh and others, we know that we can take someone's own genetics, their DNA, and stimulate that with the oral appliance that they wear just part-time during the day, 12 to 16 hours, and we can actually grow their jaws to what their DNA calls for. So it's nothing extreme, just growing the jaw just a little bit bigger to give room for the tongue. What we see is sinuses opening up, people's headaches go away, their bites improve, their TMJ issues start resolving, they breathe better, they feel better, and they look better. So we can now do it non-surgically. And this is a game changer. Our goal with some of the organizations that I'm with is to eradicate sleep apnea and sleep breathing disorders and breathing disorders for good in this country. That's our goal, and we're headed towards there, one patient at a time, one saved life at a time. So yeah, there's an answer for it, other than just sleeping with a device that pulls your jaw forward.
Yeah, and then what I hear on top of that is because you're getting that taken care of, so many of those other issues can get taken care of too, because you're putting in oxygen into your system that's going to lessen the inflammation and start the healing process.
Exactly.
So I think that is awesome. I think it's phenomenal. So thanks for sharing.
Before we go, one thing also, that it's not just an appliance that's going to grow your jaw or this, that, and the other. We evaluate every single patient, and there's a lot of different factors that tie into this. And so we identify all of those, and we work with a team of professionals. We have an ENT, we have an oral surgeon, we have myofunctional therapists, we have chiropractors that specialize in different parts of the body to get all of this lined up and to get everything relaxed And so it's a whole system approach. Not everybody needs all of those specialists, but some do. And so what we consider in our practice is that's kind of like medical central, where we go in, we evaluate everything, and the things that we don't do, we have our ENT. We need you to treat this part in the realm of this entire treatment plan for this patient to get them breathing better and to get them healthy. So it's not just taking out tonsils. It's not just an appliance. It's not just getting your back adjusted or your neck at a chiropractor. It's having someone that looks over the whole well-being of the patient and then has a team of professionals that all work towards the same goal. And that's what we pride ourselves at our office in doing.
Absolutely. It's a whole body wellness. And that's one of the reasons why I work here, is because I love that approach. Dr. Stewart, I just want to say thank you for helping us out and for informing us. And I look forward to talking to you again.
Okay. Thank you, Landis. Bye.